day today, KSAT and our community partners have been hosting a heart health phone bank, a chance for you to get all your questions answered about heart health. February is National Heart Month, and with a focus on how to prevent heart disease and encourage people to live healthier lives. Joining me right now is Sonja Brune with UT Health San Antonio. Talk to us a little bit about maybe some of the lesser known symptoms. We all think about the chest pain or, problems in your arms, numbness, things like that. What are other things people ought to be looking out for?
So other symptoms could be more vague, and oftentimes they may progress over time to the point that you don't even realize that it's happening. So oftentimes I'll ask patients, are they able to do now what they were able to do a year ago? And if not, what kind of symptoms are they having? Is it because they get tired more easily, they get more short of breath, they start to feel lightheaded or dizzy, they just feel like an overwhelming heaviness or weakness? And those could also be signs, and they may happen so slowly and progress so slowly that they don't recognize it could really be something serious.
When I met you earlier today, you said you're the medical professional that we don't want to meet. So what can people do to avoid ending up in your office?
Exactly. So my specialty is heart failure. So I see patients who are really at the very end of their disease. And so there are ways to keep from coming to see me, which is to really identify what your risk factors are for heart disease and then work to try to modify those. So the risk factors that we know about is high blood pressure. So know what your blood pressure is. Many people don't even check their blood pressure. And blood pressure that is high can actually be a silent killer. It is causing damage to our blood vessels and all of our organs without us ever knowing it. High cholesterol is another one that you can't feel, but if it's not being treated, it's going to cause damage as well. So being seen, diet and exercise, absolutely. You need to be active, and don't come up with excuses of it's bad weather or it's too cold.
We all have excuses,
We can move. We can get away from the TV and get away from the computer and just start moving. And then I also encourage partner up with people, because it's very hard to try to make these lifestyle changes on your own. So if you get someone that's sort of your cheerleader, your partner, to motivate you to get going, and when you feel a little like not doing it, get your friend to say, come on, it's time to pack up and get going.
Sonja, thank you so much for all of the good advice. These phone lines open until 7 o'clock tonight. That number to call is 351-1363.